Did you know that chiropractic care works really well for lateral epicondylitis? That's tennis elbow for everybody else. And inflammation and soreness around the elbow. So if you're suffering from tennis elbow, perhaps we can help. But how does it work? Well, it's really pretty straightforward. First, we have to diagnose and confirm the problem. Well, how do you know if you have tennis elbow? Well, first you check to see if it's a muscular component or if it's a ligament component. That's where an examination comes in. We examine the elbow. Most of the pain will be on this outside or the lateral outside of the elbow. It could be inflamed, it could be swollen. We check to see if the muscles are involved by doing a resisted wrist extension. So, Nick, we're going to keep the elbow flexed, pull up with the wrist, pull up. If that's painful, if you're getting pain in here, that's a sign of lateral epicondylitis. We straighten the arm out, flex up again. If that's painful, it again tells us there's lateral epicondylitis, but different muscles are involved. Sometimes there's no pain here, sometimes there's no pain there. You have to check both. Then we'll also check turning up, turning down, bending the elbow, and extending the elbow. We have to check all the muscles around the elbow to see where the inflammation and pain is. We also have to make sure the ligaments are intact through a thorough examination, as well as check the reflexes and the circulation to make sure it's not a nerve or a circulatory problem. Once we've confirmed it's lateral epicondylitis with an examination, and sometimes we have to take x-rays or do diagnostic ultrasound to see if there's a tear in the tendons or in the muscles, then we can proceed with treatment. We like to start first with a procedure called Graston, where we put a little lotion on the skin just to protect the skin, and then we take some tools to stimulate circulation and healing, laying down of a higher degree of scar tissue. So first a little bit of lotion to protect the skin, then we take some stainless steel tools, just relax the arm, and we stroke the skin, working right up into that lateral epicondyle. Now, if we found there was a lot of pain with the elbow bent and the wrist extension, that's going to be more of a problem in the extensor digitorum brevis. If there's more of a problem with the arm extended when we did the wrist extension, more pain there, well, that tells us there's more of a involvement of the extensor digitorum longus. The bottom line is, my job is to figure out what structures are involved. The Graston takes a few minutes and it can be a little painful. It will definitely make the skin red. Occasionally we get a little bruising. In a situation like this, I don't expect it. Sometimes when we work deeper muscles, we'll get that. So Graston goes for a few minutes. We drive some blood to the area. It will get nice and red. It also lengthens the tightness in the muscles. It also breaks down pockets of scar tissue. Highly, highly effective. Instrument-assisted release. Oftentimes, a manual assisted release is necessary in some of the deeper muscles here, where I engage the muscles with my thumb, and then we send the muscles and the joints through an active range of motion. So that would be an active release at that point. Essentially, we need to loosen up the scar tissue. Once we've loosened up the scar tissue and driven some blood to the area, then we can proceed to getting a little bit of therapy over the area, because Graston does create a little inflammation. So then we'll put a little bit of electrical muscle stimulation with ice. Why ice? Because it suppresses inflammation. It'll also serve to decrease any swelling and pain. We've iced the area, we've got some Graston on it. The next thing we want to do is strengthen it. There's some very simple exercises we use with a flex bar to help strengthen the muscles in through here. If you can't tolerate that, then we proceed directly to supportive taping with kinesio tape. Kinesio tape is a sports tape. It's flexible. It comes in different colors. The colors make no difference in how effective it is, but it's really very effective at keeping swelling down and giving us a little support. For a lateral epicondylitis of the extensor digitorum brevis, we like to brace or tape with the elbow slightly bent. We put this over here, and again, the kinesio tape, stretch the elbow and rotate it, comes out, stretches, but we don't put a real lot of stretch, just a little bit of stretch, and then we tack it down. You can hear that sticking a little bit. It sticks really well. It will work fine with this amount of hair. If we find someone's hair is getting in the way, sometimes we do shave the area, but we also have a little sticky tape that we can put on top of that. When the kinesio tape works, it works great. You'll feel almost immediate relief. A lot of times I'll take a second piece and give it a little bit of extra support. Bring the elbow out, right in through here. A lot of people have seen those tennis elbow wraps where they wrap right around here to get the pressure off this lateral epicondyle. Well, the kinesio tape works in a very similar way, but it doesn't restrict motion. So it doesn't restrict motion, but it enables healing and keeps swelling and inflammation down. That's the multifaceted approach to healing lateral epicondylitis. However, you have to make sure that the nerves coming down from the neck into the elbow aren't a problem as well. That's why the first thing before you get treatment on your tennis elbow is to make sure the problem's here and it's not somewhere else. A comprehensive examination confirm that it's a ligamentous or a muscular problem in the elbow is where you start, because if it is coming down from the neck, you got to put the treatment here. Did you know that chiropractic works really well for lateral epicondylitis or tennis elbow? Well, now you do.